Up next in this course, we will discuss delayed cord clamping, its benefits as well as the risks. Please read the legal disclaimer. By the end of this lecture, you should be able to verbalize what is the importance of delayed cord clamping, the benefits, risks, and how to properly practice delayed cord clamping. Delayed umbilical cord clamping, or DCC, is a straightforward process which allows the placental transfusion of warm, oxygenated blood to flow passively into the newborn. When practicing delayed cord clamping, early care of the newborn should be initiated, including drying and stimulating for first breath or cry, and maintaining a normal temperature with skin-to-skin contact, covering the infant with a dry linen, all to prevent heat loss and thermal regulation. Delaying of the cord clamping should not interfere with active management of the third stage of labor, including the use of uterotonic agents after delivery of the newborn to minimize maternal bleeding. If the placental circulation is not intact, such as in the case of abnormal placentation, placental abruption, umbilical cord avulsion, in all of these cases, immediate cord clamping is appropriate. Similarly, maternal hemodynamic instability or the need for immediate resuscitation of the newborn would be an indication for immediate umbilical cord clamping. Keeping in mind, communication with the neonatal care provider is essential. The ability to provide delayed cord clamping may vary amongst institutions and other settings. Decisions in those circumstances are best made by the team caring for the mother-infant dyad. There are several situations in which data is limited and decisions regarding the timing of umbilical cord clamping should be individualized. Let's discuss some of the benefits of delayed cord clamping. According to ACOG, delayed cord clamping increases the infant's hemoglobin levels and improves iron reserves for the first few months of the baby's lives. DCC lowers the blood transfusion needs, especially in the preterm baby, those born before 37 weeks. It lowers the risk of intraventricular hemorrhage, improves the transfer of stem cells and immunoglobulins from the mother's placenta to the child's body. This aids in tissue repair and fights against injury and inflammation. DCC has also been shown to reduce the risk of iron deficiency at birth, which can lead to cognitive impairment and central nervous system issues. DCC also sends more blood to the lungs, helping to strengthen them. There are many benefits of delayed cord clamping. However, there are times when it poses a risk. In cases where there is delay in umbilical cord clamping, there is a small chance of jaundice developing in those newborns. Studies have shown that clamping the cord beyond 30 seconds may increase transcutaneous bilirubin on the day of birth, while its effects seem to disappear from the first to the 5th day of birth. Clamping the cord at 30 to 60 seconds significantly increases the rate of neonatal polycythemia without the enhanced requirement of neonatal phototherapy and other adverse outcomes. There are situations in which immediate cord clamping is generally necessary, such as if there is heavy bleeding after giving birth, or if the baby isn't breathing, or any other concern requiring prompt medical attention. It is recommended to delay clamping the cord between 30 and 60 seconds and up to 5 minutes. To date, studies haven't shown delaying longer than 30 to 60 seconds to offer any additional benefits. Different from delaying of clamping the cord is umbilical cord milking, which is a manual pushing of the blood flow through the cord instead of letting it passively go to the baby. This practice is more common for preterm infants. Current research, it doesn't show that umbilical cord milking is detrimental to full-term babies, but it is unclear how vigorously they should milk the cord in the preterm baby. Umbilical cord milking and DCC have similar benefits in the full-term infant. Cord milking or stripping has been considered as a method to achieving increased placental transfusion to the newborn in a rapid time frame, usually less than 10 to 15 seconds. It has particular appeal for circumstances in which the 30 to 60 second delay in cord clamping may be considered too long, such as when immediate infant resuscitation is needed or maternal hemodynamic instability occurs. However, umbilical cord milking has not been studied as rigorously as delayed umbilical cord clamping. Studies show an increase in cord stem cells available to bank after delayed cord clamping. These stem cells could benefit the baby in the future, while delayed cord clamping benefits the baby in the present. The effects of delayed clamping or cord blood collection for banking recently has been evaluated in a public cord bank setting. In cases in which a patient and family are planning donation of umbilical cord blood, it was found that immediate cord clamping may increase the yield of cord blood obtained, which means less transfusion to the baby. However, in the absence of direct donation, the benefits of transfusion, additional blood volume at birth, likely exceeds the benefits of banking that volume for possible future use. Families who are considering banking of cord blood should be counseled accordingly. In conclusion, term and preterm infants appear to derive benefit from delayed umbilical clamping. Therefore, delayed cord clamping for at least 30 to 60 seconds is recommended in term and preterm infants, except when immediate umbilical cord clamping is necessary because of neonatal and maternal indications. In term infants, delayed cord clamping increases hemoglobin levels at birth and improves iron stores in the first several months of life, which may have a favorable effect on the developmental outcomes. There is a small increase in jaundice requiring phototherapy in term infants undergoing delayed cord clamping. Consequently, midwives and other obstetric care providers adopting delayed clamping in term infants should ensure that mechanisms are in place to monitor and treat neonatal jaundice. Evidence also supports delayed cord clamping for at least 30 to 60 seconds in preterm infants. Delayed cord clamping is associated with significant neonatal benefits in the preterm infant, including improved circulation, better establishment of red blood cell volume, a decreased need for blood transfusion, and a lower incidence of necrotizing enterocolitis and inventricular hemorrhage. In terms of maternal outcomes, delayed cord clamping does not increase the risk of postpartum hemorrhage or the need for blood transfusion. And lastly, postpartum maternal hemoglobin levels are not affected by delayed clamping compared with immediate umbilical cord clamping.